السيدات والسادة، نود إعلامكم أنه سيتم عرض باركود على الشاشة بعد الانتهاء من البرنامج، والذي يحتوي على اختبار قصير، وسيتم منحك شهادة بعد اجتياز الاختبار واجتياز التدريب العملي. نتمنى لكم مشاهدة ممتعة.
Ladies and gentlemen, we would like to inform you that a barcode will be displayed on the screen after completing the program, which contains a short test, and you will be given a certificate after passing the test and practical training. Enjoy watching.
Hello, my name is Omar. In the next few minutes, we will learn some things about safety in health buildings with my friends Samir and Layla. Hi Samir. Hi Omar. Hi Layla.
Hi Omar.
Layla, tell us about the points we will learn in the safety course.
We will highlight some points that you should know in the world of safety, divided into 3 parts. Part 1. Safety concepts. Race. Pass. Second part. Safety codes. Emergency exits. Third part. Hazmat. We will also remember some important points in the world of safety.
Samir, what are the points that we will remember together?
Of course. We will remember the following points. Steps to activate the alarm. Steps to report a fire. Contain the fire. Evacuation responsibility. Assembly points. Handling hazardous materials. Warning. No smoking inside health buildings. Using electrical connections, water boilers, coffee makers, microwaves, electric ovens, scented candles and incense may cause a fire and expose your life and the lives of others to danger.
Let's go. What is the concept of safety?
Safety is the protection of life, property, and the environment by taking precautions and preventive measures to prevent accidents. Samir, tell us about the safety levels.
Okay. Personal safety. Safety surrounding area. Complete safety of the place. Remember, when announcing an accident, the first must be ensure your personal safety. After that, you can provide assistance in the surrounding environment or go to the accident site inside the building to provide assistance if you are one of the persons authorized to do that. Must be known the nearest emergency exit and the nearest assembly point.
What is RACE?
RACE. Rescue, alarm, confine and extinguish or evacuate. This means stands for remove, alarm, confine and extinguish or evacuate. This easy to remember acronym is our hospital's procedure in the case of a fire. Also, every staff member is trained to recognize and respond appropriately in the case of a fire using this term.
In case of fire.
Rescue. Remove everyone from the area. If a fire occurred in a patient room, the staff should immediately remove the patient from the area.
Alarm.
Alarm. The fire alarm pull station shall be activated. Call 2222 to report fire. Fire alarm pull stations are located throughout the buildings, several on each floor. By activating the fire alarm, a fire action plan is set into motion, where the fire response team receive the signal and initiate the activate emergency plan. In addition, certain systems that could increase fire spread are automatically shut down.
Confine.
Close all doors. Put damp towels under the door. Test the doors and doors locks heat. Move portable oxygen cylinders. Shut off oxygen valve as advised by the hospital director.
Extinguish or evacuate.
When practical and only when an employee has been properly trained in the safe and proper use of a fire extinguisher, extinguisher shall be attempted using one fire extinguisher. Evacuate if you are not comfortable using a fire extinguisher or if more than one extinguisher is needed.
Remember. Steps to activate the alarm.
1. Shout code red, code red. 2. Pull the nearest pull station. 3. Call 2222 and inform about fire.
Steps to report a fire.
1. Remain calm and speak clearly. 2. Give your name. Example. Code red CPR, my name is Maria, please repeat. 3. Give the exact location of the fire. 4. State if people are in danger. 5. Repeat the message to the telephone operator. 6. Ask the telephone operator, repeat the message back to you. If possible.
Also, in evacuation situations, the plans and instructions of the Hippo team are implemented.
Our patients and visitors depend on us to know what to do in the event of a fire emergency. You must know exactly what steps to take and follow the proper policies and procedures. Knowing and following them will help ensure the safety of our patients, staff, and visitors. We use RACE as an acronym to remember these steps.
R is for rescue, A is for alarm, C is for confine, E is for extinguish, evacuate.
Imagine it's a normal workday on your unit. You are walking by a patient's room and you notice an electrical outlet malfunction that has caused a fire in a nearby trash can. Rescue anyone in the immediate point of danger. Alarm. There are 3 steps to alarm during a code red. Verbally announce there is a code red to other staff members. Activate the nearest fire alarm pull station. Call the appropriate numbers. Give a good description of where the fire is. Tell the operator your name, unit, department, building name, address, floor, room number, what's on fire, and a callback number. Depending on your work location, some off-site clinics or business offices may not be equipped with fire alarm pull stations.
Become familiar with your area. Find out if you have fire alarm pull stations and what number you should call in the event of a fire.
Make sure you know if you can dial extensions in a fire emergency. Confine. Confine the fire to one location. Automatic doors tied to the fire alarm system will close when the fire alarm is activated. These doors will create smoke compartments within the hospital. Staff must help by closing patient room doors. This will help limit the spread of heat and smoke to other locations. Extinguish. Try and extinguish the fire if it is safe to do so. We use PASS as an acronym to help remember the steps to use a fire extinguisher. Pull the pin, breaking the plastic seal used to hold it in place. Make sure you pull the pin completely out. If not, the extinguisher will not discharge. Aim the nozzle at the base of the fire. Squeeze the handle. Sweep side to side. Try to stand about 6 to 10 feet away from the fire. Always have an exit to your back. Remember that there is a fire extinguisher at least 75 feet of travel from any point in the building. Grab as many as possible just in case one extinguisher isn't enough. Evacuation. In the event the fire gets out of control, an immediate evacuation from your area is necessary. Follow these evacuation procedures. The first level of evacuation is horizontal evacuation.
Relocate patients, staff, and visitors to an adjacent smoke compartment by crossing through smoke compartment barrier doors. This evacuation can be initiated by any nurse involved in the fire incident.
How to use a fire extinguisher. The PASS system stands for pull, aim, squeeze, and sweep. It describes the stages in which a fire extinguisher should be operated and explains what each stage entails, giving enough information for the operator to use the extinguisher safely. While it is totally natural to panic in the event of a fire, if you can remain calm and remember the PASS technique, you may well be able to put out the fire and save yourself and those around you from serious consequences. If a fire breaks out, sound the fire alarm, and if you deem the fire as worthy of professional help, call the emergency services before you try and tackle the fire yourself. What is PASS?
Pull. Pulling the pin breaks the tamper seal, making the extinguisher ready for use. Aim. Aim at the base of the fire. Squeeze. Squeeze the handle to discharge the extinguisher at the fire. Sweep. Sweep from side to side, keeping the extinguisher pointed at the base of the fire until the fire has gone out. Be careful, as the fire could reignite. Repeat steps 2 to 4 if this is the case.
To operate a fire extinguisher, use the 4-step PASS technique. Pull the pin at the top of the extinguisher. Aim the nozzle of the extinguisher at the base of the fire. Squeeze the handle to discharge the extinguishing agent. Finally, sweep the nozzle back and forth at the base of the fire from side to side. Always remember, having a fire extinguisher and knowing how to use it is essential for every establishment.
Safety codes.
The hospital emergency codes are coded messages often announced over a public address system, a hospital, to alert staff to various classes of on-site emergencies. Codes.
Code red. Fire, internal disaster. Code blue. Cardiac arrest, CPR. Code white. Combative abuse, violent situation with no weapon. Code pink. Child/infant abduction. Code orange. Biological chemical spill. Code brown. Utility failure. Code silver. Active shooter, hostage situation with weapon. Code black. Bomb threat. Code yellow. External disaster. Code gray. Severe weather. Trauma team. Surgical team. Code 20. Smoking inside hospital. Code 11. Adult absconded, escape missing. Code RRT, rapid response team. Code MI, myocardial infarction team. Code MCT, media control team. Code PRRT, pediatric rapid response team. Code lavender. Second victim support program.
Finally, all clear. End of disaster.
Remember, this picture means assembly points, and this code used if the full hospital evacuation.
Emergency exits and escape routes. Layla, what do you know about escape methods?
Escape paths are the safe path that a person takes to escape from the building to a place where he finds safety and security. They are the transportation paths that the occupants of the building take to move from any point in it until they reach the open air outside the building or to any safe place. Escape routes may include horizontal, vertical, and inclined paths and consist of 3 parts. 1. Path to the exit. It is the part of the escape route that leads to the exit entrance. 2. Exit door. It is that part of the escape route that leads from the floor served by this exit to a public road or to a safe space approved by the competent authority. The exit shall be separated from the rest of the building area by fire separating walls that meet fire resistance requirements in order to provide a safe path of movement to the outside or to the exit drainage port. 3. Exit discharge port. It is the part of the escape route that starts from the end of the exit to the public road or safe space approved by the competent authority. We will show an example of this. The green lines indicate the paths of access to emergency exits. The red circles show the emergency exits with the drain port from inside to outside. The blue arrows show the path from the outside to the assembly points. Samir, what do you know about hazardous materials?
Layla. A hazardous material is any item or agent, biological, chemical, radiological, and/or physical, which has the potential to cause harm to humans, animals, or the environment, either by itself or through interaction with other factors. All hospital liquid chemicals must carry a hazardous materials label. This is the label that appears on the screen, which facilitates understanding the danger and safe handling of these materials.
How to deal if any hazardous material is spilled.
Remember, there are two cases. If any hazardous material or amount of blood is more than 30 milliliters. 1. Secure and close the area. 2. Activate code orange by calling the hotline 2222. 3. Read the hazmat file and the MSDS file for the spilled material. 4. Communicate and coordinate with the code orange team until the case ends. If the amount of blood is less than 30 milliliters, contact the housekeeping team. It must be known that chemical spill incidents often occur in laboratories, pharmacies, and sterilization departments. This must be taken into account.
Warning, warning, warning.
Smoking is prohibited inside the hospital according to instructions from the higher authorities. A fine, 200 rials. It will be imposed on violators of the law. Hospital employees who violate the law are directed to the legal department to apply regulatory penalties, in addition to a financial fine.
يمنع التدخين داخل المستشفى حسب التعليمات من الجهات العليا. هناك غرامة مالية مقدارها 200 ريال يتم فرضها على المخالفين للقانون. ويتم توجيه منسوبي المستشفى المخالفين للقانون إلى الإدارة القانونية لتطبيق العقوبات النظامية، بالإضافة إلى الغرامة المالية. لذلك تم التنبيه.
Ministry of Health instructions indicate prohibition of use, electrical connections, water boilers, coffee making machines, microwave, electric ovens, scented candles, incense. The use of these electrical devices and connections affects the electrical loads and causes short circuits, and the use of scented candles and incense may cause fires and expose your life and the lives of others to danger. It is also difficult to evacuate patients inside critical departments who using medical equipment, and cause damage occurs to state property is estimated at millions of rials. Also, if the hospital is completely evacuated, this will affect the rest of the region's hospitals because cases will be transferred to them and the provision of basic services to those in need will stop. So we hope you take that into consideration.
تشير تعليمات وزارة الصحة حظر استخدام التوصيلات الكهربائية، غلايات المياه، ماكينات صنع القهوة، الميكروويف، الأفران الكهربائية، الشموع المعطرة والبخور. إن استخدام هذه الأجهزة والتوصيلات الكهربائية يؤثر على الأحمال الكهربائية ويسبب مسا كهربي، كما أن استخدام للشموع المعطرة والبخور قد يسبب حرائق ويعرض حياتك وحياة الآخرين للخطر. وفي حال حدوث حريق لا سمح الله يصعب إخلاء المرضى داخل الأقسام الحرجة الذين يستخدمون الأجهزة الطبية، ويتسبب في حدوث أضرار بممتلكات الدولة تقدر بملايين الريالات. كما أن إخلاء المستشفى بشكل كامل سيؤثر على بقية مستشفيات المملكة، لأنه سيتم تحويل الحالات إليها وتوقف تقديم الخدمات الأساسية للمحتاجين، لذا نأمل أن تأخذ ذلك بعين الاعتبار.
Thanks for watching. You can now scan the barcode appearing on the screen and answer the questions. Then go to the practical training location to complete the training program.
شكرا للمشاهدة. يمكنكم الآن مسح الباركود الظاهر على الشاشة والإجابة على الأسئلة، ثم التوجه إلى موقع التدريب العملي لإكمال البرنامج التدريبي.